Epidemic hemorrhagic fever, more commonly known as hemorrhagic fever with renal syndrome, HFRS, was first recognized during the Korean War, 1950–1953. However, its history can be traced back to earlier times. The disease was known in Scandinavia and Russia for centuries, often referred to as nephropathia epidemica in Scandinavia. The causative agent, Hantavirus virus, a type of hantavirus, was identified in the 1970s. Hantaviruses are responsible for various hemorrhagic fevers worldwide, with different strains causing different diseases, such as Hantavirus virus in Asia, associated with HFRS, and Sin nombre virus in the Americas, associated with hantavirus pulmonary syndrome. Epidemic hemorrhagic fever, particularly when caused by hantaviruses, is transmitted to humans primarily through indirect contact with infected rodents or their excreta. The most common route of infection is through inhalation. This occurs when rodent droppings, urine, or nesting materials are disturbed, leading to the release of tiny, virus-containing particles into the air. Inhaling these aerosolized particles is a significant risk, especially in enclosed spaces like sheds, cabins, or other buildings where rodents may be living. Direct contact is another route of infection. It happens when a person touches objects or surfaces contaminated with rodent excreta and then touches their nose, mouth, or eyes. Although this route is less common than inhalation, it still poses a potential risk of transmission. Infection through rodent bites, while less common, is also a possibility. If an infected rodent bites a person, the virus can be transmitted directly through the bite. There is also a very rare chance of infection through ingestion. This could occur if someone consumes food or water that has been contaminated with the virus. It's important to note that person-to-person transmission of hantaviruses is extremely rare. The risk of infection is primarily associated with exposure to environments where infected rodent populations are present. Preventive measures are crucial and focus on avoiding contact with rodents and their excreta. This includes sealing up homes and workplaces to prevent rodent infestations, cleaning up rodent food sources and nesting sites, using rodent traps, and ensuring safe and proper cleanup of rodent-contaminated areas to avoid aerosolizing the virus. In high-risk settings, wearing protective gear like masks and gloves can also help reduce the risk of infection. Epidemic hemorrhagic fever, particularly when caused by hantaviruses, typically begins with symptoms that are nonspecific and can easily be mistaken for those of the flu. The initial phase, which usually appears within 1 to 2 weeks after exposure to the virus, is characterized by fever, fatigue, muscle aches, often in large muscle groups, headaches, dizziness, chills, and abdominal problems such as nausea, vomiting, diarrhea, and abdominal pain. The incubation period can vary, ranging from a few days to several weeks. As the disease progresses, more severe symptoms can develop, especially in cases of hantavirus pulmonary syndrome, HPS, or hemorrhagic fever with renal syndrome, HFRS, which are among the more severe forms of hantavirus infections. In HFRS, the symptoms may escalate to include acute kidney failure, which is marked by reduced urine output, fluid overload, electrolyte imbalances, and in some cases, severe bleeding or hemorrhage. In the case of HPS, patients may experience severe respiratory distress as their lungs fill with fluid. This is often accompanied by a cough and shortness of breath. In severe cases, the disease can lead to complications such as low blood pressure, shock, vascular leakage, and acute respiratory distress syndrome, ARDS. These complications are serious and can be life-threatening, requiring immediate medical attention. The severity of the disease can vary widely among individuals. While some may experience only mild symptoms and recover fully without specific treatment, others may develop severe, life-threatening complications. Early recognition and medical care are crucial for managing severe cases and providing supportive care, which can significantly improve survival rates. Treating epidemic hemorrhagic fever, especially when caused by hantaviruses, focuses on supportive care, as there are no universally approved specific antiviral treatments for these infections. The approach to treatment varies based on the severity of the symptoms and the specific type of hemorrhagic fever. The cornerstone of treatment is supportive care, which involves managing the symptoms and complications as they arise. This includes careful fluid management to maintain hydration while avoiding fluid overload, particularly in cases involving kidney involvement or shock. Monitoring and correcting electrolyte imbalances is also crucial. For patients experiencing respiratory distress, supplemental oxygen or mechanical ventilation may be necessary. In cases of shock, medications to manage blood pressure are often required. Additionally, in severe cases involving kidney failure, dialysis might be necessary. Patients with severe forms of the disease usually require hospitalization for close monitoring and management of potential complications. While there are no specific antivirals for hantaviruses, some treatments like ribavirin have been used in certain cases of hemorrhagic fever with renal syndrome, HFRS, particularly when administered early in the course of the disease. However, the effectiveness of such treatments is still a subject of ongoing research and debate. Preventing secondary bacterial infections is also a key aspect of care, especially in hospitalized patients. Addressing specific complications, such as acute respiratory distress syndrome, ARDS, or severe bleeding, is a critical part of the treatment process. In some regions, specific immunotherapies or vaccines may be available for certain types of hemorrhagic fevers, but their availability and efficacy can vary. Early recognition and treatment of the disease are crucial for improving the prognosis. If there's a suspicion of exposure to a hantavirus or symptoms indicative of epidemic hemorrhagic fever, seeking medical attention promptly is essential.